So basically it's a stainless steel breadbasket. We put some UV light strips in there and also an automatic timer. So, I could set it and then when it's done curing, we could take it out. Okay. That was back in 2020, but thankfully, technology keeps improving. So nowadays, if you were considering kind of like a super low budget 3D printing solution, I would say right now they have the Frozen Sonic Mini 4K, which has even better resolution. And, it's for the same price I paid for mine, $300. And then there's also, I recommend getting any of these wash and cure units, which would make it a lot easier rather than trying to make your own. Okay. And as you can see, just kind of with this, right, it's still well below $500, but of course you have to add in your resin costs and all that as well. Okay. And, these are kind of the free softwares I'm still using, right? 3D Slicer for my segmentation, and then, all these other softwares to kind of, finalize the model, the STL model, and get it ready to print. Okay. So you could kind of see, right? This is just a sample workflow here. You design it in 3D Slicer. You import your CBCT data, you segment out what you want, and then I import into Mesh Mixer to kind of fix any errors there are. And then from there, I import it to Prusa to generate my supports. And then, import it to slice file or to slice the file on Chi2 box, and then to printing. And then then we go through the printing process here. Okay. So, with kind of the remaining time, I really want to talk about some clinical applications. So just so you have an idea of what we've been doing here at UOP. One of the first models I printed was this model here, just to kind of test the resolution of the printer. As you can see, this tooth model, it's what I would consider a high difficulty case where you kind of have like a lateral canal in the middle of the root. And then even at the end of the root, there's kind of two portals of exit. So, what I was kind of surprised at was even with this budget printer, the resolution was good enough that we could actually negotiate these small canals, not only at the side of the root, but at the end of the root as well. And then, of course, for me, the biggest advantage I see is when I'm training students, I'm working with residents, right? Being able to help them treatment plan. Because one thing I'm fond of saying is that this quote from Benjamin Franklin, where he says, if you fail to plan, you are planning to fail. So being able to have a physical, tangible model for the resident or student to, practice with before they work on the tooth, I think that's a very big advantage and a big reason why I think 3D printing is very helpful. So this is a case by one of our residents, right? This was her first time working on what we call a dens and dentate case, where, it's a more unique anatomy, where there's kind of more than one canal in an anterior tooth. And, in this case, we're kind of doing what we call a regenerative procedure, okay? So we were able to kind of generate the model in Slicer or in 3D Slicer. And then in that, we were kind of able to create some different access situations just to kind of figure out what is the best way to access this tooth. We 3D printed the model, and then she was able to practice. And then as you can see here, this image on the left, this was the resident's actual access on the patient. And then you can kind of compare it to, our simulation. And you can see just having that visual aid for her really helped her out in creating the perfect access. Okay, here's another example here. These slides, thanks to my co-resident, Dr. Suresh Oza, who was also a big part in helping us develop 3D printing here at the school. So this case, the premolar, the root canal had failed, and we were planning to do surgery to try to fix it. You can see one issue here is very close to the mental foramen, the nerve down here. So that was one consideration, we had to be very careful with. You can see with this model that we printed, the image on the right, you can actually kind of see the root, the apex here, within the bone. Okay, so this is the model we created. We were able to kind of, mark where the mental foramen is, kind of mark where we wanted to put a groove to protect the mental foramen. And then, we created a suck down stent. We were able to transfer that onto the patient. And then you can see here in the surgery, right? So this is the model. And you can kind of see how, the model really accurately replicates, what happened during the surgery here. Okay. All right, and then, one other case where I find it useful is when residents, they encounter very unique anatomy cases where it might not need a root canal, but it'd be a good case for residents, if they had that model to be able to practice on it, because, like a case like this, I would consider these are like once in a lifetime situations where a resident might never encounter this again. So being able to 3D print a model like this, and as you can see here, we're able to kind of obturate, and for future residents, we can always print this out again. So if they ever want to try obturate something like this or do the root canal something like this, they can practice that. Okay. So what does the future hold for 3D printing at UOP? Like I said, this was kind of a workflow that we developed back in 2020. And since then, we've been just finding more clinical applications to use this. One thing I recently am excited about is just kind of finding out, collaborations with other dentists out there, who have access to, higher model 3D printers. So this is a case where I worked with Dr. Josh. You can see we were able to print out this model in multiple colors since he had access to a Stratasys 3D printer. And then, the cool thing is with this printer, we can also print out, different textures of material too. So, which is one of the advantages of having these higher end machines. As you can see here, this is Dr. Josh designing the case. This is the model. You can see the outside material, it's a spongy material where we could actually, cut through it just to simulate like doing actual surgery. There's bone we actually can drill. And then, once it gets to that pink, the lesion there, we can actually cure it out. Okay. And then, one other area of interest that Jenny had mentioned is I'm also very interested in seeing how we can implement AR, VR technology into, tying that in with 3D printing. So this is a case here where, we actually, I exported the model, the STL model into the VR world using the Oculus Quest. And then we can kind of, blow up, magnify the model and look through it here. Okay. So I know I'm a little bit over my time, but just wanted to thank you all for listening. Again, I know that was a lot of material to present in a short amount of time, but feel free to email me if you have any questions. And then, if you can also check out my IG for more 3D related posts. Thank you so much.
Thanks, Gordon. Actually, your pace is perfect because our chat box wasn't working, so give me some time to fix it. And so everybody's listening in, the chat box is working finally. They just did an upgrade today, the update on the software today, and I have no idea they changed the setting. So feel free to type in your info and engage with us. I do have a question. Gordon, yeah, I remember, I think the first time I met you was like 2020.
Yeah.
Perhaps? Yeah.
Mm-hmm.
So does UOP now have an official program to teach students 3D printing? Is that part of the official curriculum now?
Yeah, so there's no official 3D courses yet. One thing I did forget to mention was that right now we are working with collaboration with all the other different departments. We're trying to build like a 3D printing center at school. Mm-hmm. So I think once we have that, that'll be very exciting. We'll probably start doing more official courses with the students. So
Awesome. I hope I would never get my root canal done. If I ever need one, I would definitely go for you. I will.
yeah,
I will call
thank
you,
you.
please, because so now, as a private practitioner, do you think that the economics is actually working out? I mean, not to talk about how much profit you can make, but at least you can make, going neutral. Do you feel like you
Uh-huh.
can do that with the implementation of this new technology?
I mean, yeah, I think in private practice, again, right, I always say it's like, when you're able to pre-plan the case, it just makes everything more efficient, more productive for the appointment. So again, a lot of times why we, right, create these models is that way we have a better idea of how to approach it. And then it actually helps speed things up, especially, right, with a lot of, I didn't really talk about like, creating like stents for surgery or, teeth that are really calcified. Often those are really the most stressful types of teeth to work on for us as endodontists.
Thanks. Okay, so I think we have a little bit technology mishap. So for people who have questions for Dr. Lai, please type in the QA box. But we will come back to you later on after other people presented and do a panel discussion. Thank you, Gordon. Okay, our next speaker is also from University of Pacific. Actually, also next door. I also knew him, Nabil, Dr. Kaji, when he was a student. I know you for so many years, Nabil. And he's also a private practitioner, but from a different kind of, is more focusing on implants. And he's always a technologist, yeah, and 3D printing enthusiast, I would say. Nabil, please share with us where you are nowadays with these technologies.
Wonderful. I'm excited to share with you what I have here. Let me just pull up my presentation. All right. All right. So thank you for the invitation, Jenny. And it's a pleasure to be on the panel with all of you. Good morning or good evening, wherever you are. Gordon, we haven't met in person, and I want to change that because I love your work. And thank you for your presentation. Today, I'm going to be showing you a bit from my life. I also attended University of the Pacific, as did Gordon. And that's essentially where my interest in 3D printing began. So I attended from the years of 2012 to 2015. And there wasn't much talk on campus of 3D printing, but I would read articles on how 3D printing was opening up. And I said, well, why aren't we designing this digitally? Why, a lot of questions emerged. So I would go around to hacker spaces around SF looking for answers. And eventually I found Jenny and the community of 3D Heals. From after my time as a dental student, I then, actually my graduation gift to myself, this was the day after I graduated from dental school, was a 3D printer. And that was one of the first things I printed on my own little printer back in 2015. And then I went on to residency at Highland Hospital, which is a regional trauma center. And I got exposure to the world of essentially implant dentistry. And implants are, in dentistry, sometimes there's a dichotomy of dentists that put in implants and dentists that then do the prosthetic work. And I just fell in love with both sides. So I said, for these cases, I want to be able to take my patients start to finish. I want to put in the surgical placement of implants, and I want to finish the prosthetics. And in doing so, it's a big task to take on, especially as these cases get more and more complex. So here is a patient of mine. I took start to finish. This is an implant case, implants place, and the prosthetic work. And when you do these cases, you want to be able to put implants in the correct places, and you want to be able to finish the prosthetics elegantly and how these two match. Here's another patient of mine. I just appreciate the difference you can make in someone's life. All right, Keith, I'm excited.
Ready?
What day is it?
Teeth day.
Teeth day. All right, my friend, take a look at your new smile.
Wow. That's awesome.
How do you like them?
I love them.
Awesome.
That is so awesome.
Congratulations, my friend.
Holy
And these are the moments that I live for in practice. When I'm able to take a patient who would otherwise need, a specialized surgeon for their implant placements, and then another specialist for prosthetic work, and we're able to do the work start to finish elegantly. Now, to do this work for patients is tricky, not just because of the time and effort involved, but also the cost to be able to do these types of procedures, and in many places across dentistry. Here's a chart that just shows basically inflation and then the consumer price index of dentistry, in the 90s and 2000s. And it shows that the cost to provide dentistry has been going up faster than inflation for years, for many years now. And to make matters worse, it's because of that, many individuals put off the access to dental services primarily because of costs. So when we're looking at taking on these cases, I'm looking for ways to be able to reduce my time in the chair, reduce the time for the patient and material costs to be able to deliver a high-end result. And COVID just made it worse. Dentists were disproportionately affected during the time of COVID, just because of how our practices were set up. We don't practice generally in hospital settings. The cost of equipment, PPE, everything else fell on the back of individual offices. And even today with supply chain disruptions, the cost to provide dentistry is significantly higher than it was previously. And for that way, I kind of see ourselves how we have been practicing, we need to take a jump. And that's why, 3D printing is a big jump that is the jump I believe we need to take. Now, many of you have 3D printed or have had experiences. I just think it's empowering to see what you can 3D print. This to me just shows, you can print internal geometries and external geometries. And for what we need to do as we in 3D in dentistry, where we're creating one-off pieces to use in patients' mouths to a high degree of precision, it's exactly what we need. So for my time here today, I'm going to be talking about 3D printing as it relates to surgical guides in my practice and from other clinicians, implants and prosthetics. Now, this is what we don't want in implant dentistry. This is an X-ray of someone's facial structures, and you can see some implants floating in their skull. We want implants in the correct place. I see Myra's face here and in shock looking at this case. We want implants where they want to go, so we minimize complications and we actually can get patients across the finish line more effectively, easier, and better. So that's where, this is another case of implants placed, and I don't even know how to finish this case. Maybe the other dentists on the panel can help us here. But these aren't my cases, thankfully. These are just examples of cases. The far majority of my cases today, basically all of my implants today, are surgically guided just because I appreciate the degree of precision we can get. So I'll run you through a few of these examples. Here's an example of surgical guides that we print in our office. And, I often print the models and the guides. Here's a patient that who presented to my office, missing front teeth. You may notice just off the get, or appreciate that the front tooth that he does have is much darker than the rest. As you'll see, he didn't want to correct that. He just wanted to have the other teeth restored or replaced. So in his case, what I did was I simulate his treatment. I plan out where I want the teeth to go, where I want the implants to go, and then that teal structure you see is the surgical guide. From there, I can take it to the patient. These cases in the past, to place these implants would take me about 2 hours to place, an hour and a half to 2 hours. In his case, I place his implants in 45 minutes because I know exactly where I need to go, minimal reflection, just surgical precision.